Welcome to Adventist NCLEX, and thank you for deciding to watch this video. Religion and culture consideration. I know it's very difficult. There's a lot of religions, but I pick those that I know you will show up. If they're going to ask you questions, these are the ones they will ask you. So let's practice some questions on those key religions that shows up, okay, in a question form. First one, important. Test-taking skills we're going to apply it. Select or apply. Which practice the nation should anticipate? And then this is caring for a client that practice kosher law. What you being asked? What is kosher law? That's all. Rewrite it in the form that is better for you. What is kosher law? It is practiced by Judaism. And then they have specific diet they're supposed to eat. They will allow meat from animals that eat vegetables. They will allow meat from animals that chew their cuds and they have cloven footed. The meat should come from the animal that is slaughtered. They don't want you to eat fish without fins or scales, or fish, and fish that have shellfish, right? It's not allowed. They don't want you to eat pork. If you want to eat meat, you should not eat it with the milk products that come from the meat, consumed simultaneously. So does this allow meat from animal that eat their vegetables, meat from animal that chew their cuds and a cloven fig, the meat from animal that is slaughtered, but you should not eat fish that has fins, without fins or scales, or a shellfish. You should not eat a pork. The meat and the milk product cannot be taken simultaneously. So this is not allowed. So the first 5 is allowed. If you want to eat the milk and the meat, you have to wait 6 hours. So you eat the meat, then you wait 6 hours and drink the milk. So this is what is true kosher law. I put everything you need to know about the diet for kosher law. There's utensils for kosher law too. So this is the diet portion of it. So first one. Number 2, since we saw that, right? So select or apply. Which mail ordered by the client indicate adherence to the kosher law? We have 5 clients, basically 6 clients who adhere to the kosher law, right? So key things, no pork. You shouldn't eat any pork. You should not eat any fish that has no fins, okay? Like crabs and those without shells and scales, right? You should not eat any fish. You should not drink the milk and the meat at the same time. And then you can eat the meat, right? It should come from animals that eat vegetables, chew their cud, they have cloven fitted, and you can combine the meat and the milk together. So we have chicken, that is okay, rice, okay. We have beef, that's meat. I don't see any pork here. I don't see any milk product. So this is good. So this is practice kosher. I see chicken, rice, and beef, but there's beef, which is cow. It cannot have its milk together. So this is not. Oatmeal is okay, toast, chicken, they don't eat pork. At the same time, we have a milk there. So oyster, there's no scales, there's no fins, it's a shell animal. So this is the take away the problem. Otherwise, the rest is fine. Egg, bread, oatmeal, orange, and juice. That's good. We have a beef. It's good. Shrimp is wrong. Pork is wrong. So there's only 2 answer choice that show clean kosher. Pork will make everything wrong here. Oyster will make everything wrong here. Yeah, another pork and milk, right? And then beef and milk. You can't eat beef and milk at the same time. So 1 and 3 is the right answer, consistent with the individual practicing kosher law. Same thing, trying to hit that topic. Select or apply. Which client the next should anticipate will practice kosher law? The next is caring for 5 clients who practice kosher law. It's not Muslim. Okay, it's not Muslim, right? It's not Catholics. It's not 7 days. It's not the Jewish. It's Orthodox Jews. They are the one that practice kosher law. This one is straightforward. Number 4, select or apply. Which action by the nurse is appropriate? Why is it appropriate? What action? A nurse is caring for a client who adhered to what? Kosher. The same thing, right? With eating the thing. So if you practice kosher, separate utensils were used for meat and milk product. Yeah, you should use different utensils for your meat, and then you cannot use the same thing for your milk product. So this is good. Paper plates were used for serving. Yeah, you need to use paper plate, no plastic plate, no metallic plate. Seal metallic utensil. The utensils has to be sealed, but metallic is wrong. It's plastic. So plastic. Seal plastic utensils are usually used. Next, unwrap the utensils. No, unwrapping of the utensils is done by the patient. 2 meals should contain dairy product. If you're eating 2 meals, it should contain dairy product. If you're eating 1 meal, yeah, it should contain meat. So this should say meat. It should contain meat, basically. So use 2 different utensils. Okay, for the meat and the meat product, use a paper plate. The utensils should be sealed in plastic, and the patient will unwrap it. And if you have to eat 2 meals, dairy products. If you want to eat 1 meal, you have 1 meat. That is kosher practice right there. Which item the nurse you anticipate the client will order? So which item? Select or apply, right? Which item the nurse you anticipate the client will order? Select or apply. And nurse is caring for a Muslim client who need help to order food from the cafeteria. He's going to order food. So which item the nurse you anticipate the client will order? No fermented fruit and vegetables. Yes, this is what they do. They don't like fermented fruit and vegetables because if you get fermented, they have alcohol in it. They don't eat pork. They don't drink alcohol. They like food with precious value. These are in the Bible. Olives, figs, dates. Yeah. The meat, okay, you got to drain off the animal, and Allah means you pray on it. Okay, meat drain of blood, and then before slaughter, it has to be pray upon. Like they pray for the animal, and that is what they call Allah. Meat must be slaughtered humanely, yeah. And they don't like gelatin and animal with fangs. So these are keys for Muslim people. So these are the things you should pay attention to. Fermented products, they don't like it. Pork, they don't like it. Alcohol, they don't drink. They like fig, date, things that has a lot of value. You have to drain the blood with the Allah by praying for the animal, and then they have to be slaughtered in no gelatin. Number 6. Which next action is appropriate? Select or apply. A nurse is caring for a deceased is dead client who prescribe Judaism. So you have somebody who practices Judaism. How do you want to proceed? Encourage the family members to allow autopsy. They don't do autopsy, so this is wrong. They don't like it. Notify organ procurement. Yeah, they're okay with organ procurement. Request that a family member leave the room. There should be one family member in the room at all time. Should not leave. So this is wrong. That's all wrong. Okay, ritual bathing and burial within 48 hours. No, it has to be within 12 hours. Advise the family to pursue cremation. Yeah, they like doing that. Those who practice Judaism. So this is good. This is too long. 24 hours, yeah. Request family, they want to stay with their family member. And then organ procurement is good. But no autopsy. Number 7. Select or apply. Same idea. Which action is appropriate? And this is caring for a deceased client who is a Muslim. What do you do when the patient is a Muslim? You close their eyes. You let them face where? East, no west. They faced east. Client moves to the client moves to the morgue right after birth. No, somebody need to see them and clean them out before they go to the morgue. Client facing Mecca. Yes, excellent. Next is discusses organ donation and autopsy. Yes, they allow this, but the client has to face Mecca, which is eastward. I mean, somebody have to stay with the patient, and he should not be moved right after death, and taken to the morgue. Somebody have to be there to clean him up. Number 8, select or apply. Which practice is consistent with the religion the nurse should include in the teaching? A nurse is teaching new graduates about how to care for a client with Muslim. So which one is consistent with it? Okay, so change hospital gown frequently. Yeah, you want to change it frequently because it's a hygiene issue for them. Allow prayer 5 times a day. Yes. Provide a basin of water at bedside. This is where they can clean themselves and do prayers. Women may refuse male air care providers. This is allowed. And privacy during prayer. You should do that when you're praying and stay away from them to give them privacy. So that's those answers. Same idea, same thing. Select or apply. Which practice is consistent with the religion the nurse should include in the teaching? The nurse is teaching new graduate about how to care for a client who practice a dying client who practice Hinduism. So the client is dying and they practice Hinduism. So which of this is consistent with that? They would like to lay on the floor. This is true. They like to lay on the floor to communicate with your spirit. Place a thread around the neck and the waist. This is their normal practice. You see a thread around the neck and the waist. They like organ donation. They okay with cremation, but they believe in incarnation. So all of them are consistent. They okay with organ donation, but most of the time the practice is to cremate the individual, and they believe in reincarnation. So all of this are right. This is consistent with their practice. Like you said, this is a content to know what is the fact about these people. It's all fact based, and if you remember them, yeah, you get the answer straight. Which of the prohibited diet choice is accurate for the religion indicated? Look at the word choice. So there's a diet that is prohibited, that they don't like it. Okay, which of this is consistent with that? Hinduism, beef and pork, excellent. They don't like it. Muslim, pork and some shellfish, they don't like it. Judaism, they like meat, but they don't like pork. So the answer choice is still wrong. Seventh-day Adventists, they don't like coffee or tea. They too, they don't like pork. They don't like pork at all. So that's that portion of it. Question. Okay. 11. Which teaching is appropriate? Select or apply. And this is teaching new graduate on how to care for a Seventh-day Adventist client. How do you care for them? So very, very important key facts I try to give you as much as possible. They're okay with organ donation. They're okay with autopsy. They encourage vegetarian diet. They avoid caffeine and tea. And they avoid pork also. So this is consistent with the disease. A 7 days Adventist practice. Okay. Which teaching is appropriate? Select or apply. And this is teaching you graduate on how to care for a client with days. Now we're on Buddha. So what do you think? They like calm and peaceful environment. Um, they do meditation and chanting, so you provide some privacy. Organ donation is encouraged. They allow them to donate their organ. And they are lacto, that means milk, ova, egg, vegetarian. They may refuse care during the early days for them. So all this is right for these people. Selected by which teaching is appropriate. And this is teaching you graduate on how to care for a Mormon. What do you think? How to care for that. They don't like alcohol. They don't like that. They don't like alcohol, coffee, or tea. They allow autopsy. Organ donation is encouraged. They love herbal remedies. And they like to fast once a month. In herbal remedies, they will take your medication, but they also practice herbal, where they like herbal therapy to help with the situation. So they like that. Don't question them. And this is teaching you graduate on how to care for a client with diverse religious practice. Which group prohibits pork? All it means is there's a bunch of groups that hate pork. So African Americans don't eat pork. Islamics, yeah, they don't like it. Judaism don't like it. And Seventh-day Adventists, Mormon, they have no problem with pork. So Islam, Judaism, and Seventh-day Adventists are your friend. Number 5, which teaching is appropriate? Select or apply. Okay, which teaching is appropriate? Which teaching is appropriate? And this is teaching new graduate on how to care for a Jehovah Witness client who needs surgery. So if you have a Jehovah Witness clients who need surgery, they don't like blood transfusion. But there's certain things we can do to help with the situation. We can transfuse them with iron. We can use cell saver. The blood that is going to be lost in surgery will be taken, filtered, and given back to the patient. So cell saver. That is what we call auto transfusion. We're taking your own blood and we're giving it to you. We can also use hypotenuse alpha to stimulate red blood cells, so hypotenuse alpha. So that is good. We can also have plasma expanders. We have expand, things that can pull blood into the water into the bloodstream, stay there for a long time. We call them plasma expanders. So those are also can be used. So all these things can be used for Jehovah Witness patient who does not want blood to be transfused. So iron transfusion, cell saver, transfusion, hypotenuse alpha, and plasma expanders are all reasonable source of blood for these people. And this is caring for a client who abstains from meat on Fridays. which practice is appropriate. So which one? Islam? No. Judaism? No. Buddhism? No. It's Catholic. Some Catholic don't like meat on Fridays. Short question. Which action by the nurse is appropriate? So there's some action. The nurse is caring for a client from Benin who believe that having breakfast at 7:45 will help with the new diagnosis of cancer. It doesn't matter whether it's Benin, wherever. I just choose some place in Africa. It doesn't matter. If a patient tell you, if I do this, help with my medical problem, there's no need to argue. So don't change the conversation, whether you believe it or not. You just have to accept it, and you have to culturally be sensitive. You don't need to call the chaplain. You can call the dietitian, and they can make sure the cafeteria brings food 6:45 because it's off the normal time to bring food. Dispute the notion. You should not dispute it. Disrespectful. So this is good. Which response by an nurse is appropriate? A nurse is caring for a client with diabetes from South America who believe that the diabetes is controlled due to herbs prescribed by the traditional healer in their community. So which one is good? Herbs are not scientific. It's not of your business. That's not what she's asking. You got to be therapeutic. Herbs are harmful. Maybe true facts, but I still not answering the question. Tell me more about how the herbs may help you. Yeah, talk about it. I need to know how it has helped you so that I can know. So let the patient talk. Herbs cannot be combined with medication. Still fine, but it's not the patient talking. Tell me more. So then they will give you more information. It's the most appropriate to know more about it. That means you engage in the patient in conversation. The nurse is caring for a new immigrant client with limited English. Which action by the nurse is appropriate? Somebody limited English, you need an interpreter. So don't use the daughter, don't use the brother, don't use the son, use a hospitalized and trained professional interpreter. Speak to a low in the tone voice. No, it's not appropriate. Finally, which action by the nurse is appropriate? A nurse is caring for a client who practices Judaism. The breakfast tray contains beef sandwich and whole milk. Do you see something wrong with this? It's a beef sandwich. So it's a meat and a whole milk. Cannot combine. So what action? Give the breakfast to the client. No, it doesn't practice kosher. It is not consistent with kosher. Or order a new breakfast with just the sandwich. This sounds better. You just get a sandwich without the milk. Order a new breakfast with shrimps. We don't eat shrimps. Replace the beef with crab. Still, we don't eat that. So this is the end of this to show you how they can take you. Like I said, it's exhausted list of religion. This is few that they testable that they like to ask you mostly. And it show up on your board. So good luck for staying around. All the best of luck. Keep charging and put your subscription on so that and notification so that when I made a video, you'll be the first to see it. Thank you very much for your time and all the best of luck.